You're listening to the Beauty Beyond Bella podcast, powered by Formula Wellness.
I'm your host, Dr. Yvette Suarez, owner and medical director of Bella Excellence, a diamond-accredited anti-aging med spa in the Tampa Bay, Florida area. On this show, we explore the latest trends in health, beauty, and anti-aging medicine while celebrating the inspiring journeys and achievements of our guests. Well, welcome. Today we are back and we are with the beautiful Lauren Olsen. She is an owner of Radiance Med Spa, which is located in Woodlands, Texas, which is absolutely amazing. She's also an allergen trainer and my sister with Formula Wellness. So welcome here. Let's get right into it. We both have about 40 years experience in the aesthetic field, and there's a controversy out there right now talking about pillow face. So I'm going to let you take that away.
Okay. Well, when dermal fillers were first FDA approved, where did we start? We started in the nasolabial folds, right? Then we went to the lips, and then we went to the mid-face. And over in Europe, they have thousands of dermal fillers. FDA approval of just a handful early on. And now we have a lot at our disposal to choose from. But I think early on, whether it was pushed by desire from the consumer, sales by the manufacturers, or our overzealousness to use these really cool products, many injectors went overboard. And in trying to lift the lower face, because that's oftentimes the most common request we get, there was this misconception that if we filled in the mid-face, we were going to lift the nasolabial folds, we were going to lift the lower face. And to be realistic, one syringe of hyaluronic acid filler is 1/5 of a teaspoon, the size of a blueberry, and it's a gel. So and I tell my patients who come in with complaints of lower face droopiness, is that if we put enough dermal filler in the mid-face to lift this, you're going to look like an overstuffed Cabbage Patch doll. So I think we recognize that now. But early on, there was overuse of filler. But as you and I have discussed, we can put 10 syringes of filler in someone's face, and it's undetectable, except that they look refreshed. They looked balanced, facially balanced. Or someone else can put 10 syringes of filler in someone's face, and they can look like a balloon.
Yeah, I absolutely agree. Look, I think we overblame the amount of fillers that we put in, but we all know because it is the size of a little blueberry, you can add a little blueberry in multiple locations and look refreshed and never doughy. I think the concept of the pillow face, of looking doughy and very filled, has multiple things, right? I mean, we can look at where is it being placed, right? You and I know that we need to go to periosteum if it's on cheeks. Some people now are way overfilling in that fatty pad, and with the hydrophilic nature, they're getting that more filled look, which looks really pretty initially, but long-term may lead to a little bit more of that doughy look.
Mm-hmm. And for non-lay people, I think maybe let's discuss what differentiates dermal fillers. And I tell patients there are 4 things that differentiate dermal fillers. Well, first of all, taking a step back, mainly in this country, we use hyaluronic acid fillers. Hyaluronic acid is what we have naturally in our joints and in our skin. It draws water to it. But they're not all the same. They're not all created equally, thankfully. So one differentiator is its lifting ability. So if we want to go on the bone injecting to add volume to the mid-face, to the cheekbone, we want a filler that's got a lifting ability, what we in the business call G prime. The second differentiator is its cohesivity or its stretchability. If we're putting filler in expression areas, we want a filler that's going to move with the face. The other is its attraction of water. If we're injecting in the tear trough area, we do not want a filler that's going to attract a lot of water. However, if we're injecting the lips, we want hydration. And then the fourth is the concentration of hyaluronic acid in that syringe of filler. So it takes a skilled injector to understand what's called the rheology of fillers and knowing in our arsenal of fillers, what's going to be best for that patient in that part of their face.
Yeah, I agree. And that's going to really change the look they have, right? You don't necessarily want to put a filler, since we're both Allergan girls, you don't want to put a filler like Voluma or even Rest and Lift in an area that's supposed to be very soft, like the lips. It's going to have way too much lifting capacity and very hard and unnatural looking, right? And so I think every provider needs to know all of those areas of what you want to lift, how should it move, is it going to pull water? And that's sometimes very difficult for, I think, new providers that are starting to learn that. I know we used to have this fun little joke that I used to have an actual schematic on the board for all my team and go, this is from least thick to the highest prime, right? And so that really kind of helps people understand that. Talk to me a little bit about not only the quality of what that filler looks like, but maybe positioning, whether you're going to go on bone, whether you're going to go on soft tissue, what's the best techniques to use so they don't look overfilled?
Okay. So if we're specifically mid-face, I like to go periosteum. And what that means is we're injecting with the needle down to the bone, laying down little boluses. I explain it to patients is like laying down tent pegs that are going to lift that skin. But there's another technique of contouring, and we might use a cannula for that. And that's just more for refining the contour. So going periosteum is building the foundation, and using the cannula for contour is more like icing on the cake.
And then let's talk a little bit about people worry that what if they don't like it? What if there's a complication? Can you remove it? And is it very safe?
It is very safe, and legitimate injectors know that we keep Hylenex on hand. Hylenex is an enzyme that breaks down hyaluronic acid. And yes, it can be dissolved. But I'll tell you this, there's been a trend of especially movie stars who talk about dissolving their filler there on social media. So some people see that and they think, oh, I guess I need to have my filler dissolved. Once that filler is dissolved, it's like aging backwards, and they're going to want to be refilled because we do lose volume as we age.
Absolutely. You don't want to dissolve everything. I always tell people you're only dissolving if something looks really unnatural, or somebody did a bad job, or maybe sometimes you just get a little nodule. Those are really great times to dissolve. But I think what they don't understand is, like you said, HA is a natural component of our skin and tissue. So when you dissolve the filler, you are also dissolving some of your natural HA. And so you might get some irregularity, and then you're going to feel like a month later you need to be refilled because now you've aged and decreased that volume quickly.
Right. And I'm glad you mentioned that about being a natural substance. And it is. It breaks down into a sugar water solution, and the body just reabsorbs it.
Yeah, absolutely. And then we're talking about, so we've talked about how we can do that we can dissolve it. And now there's a trend also to going to more fillers that may be causing more collagen stimulation, like hyperdilute Radiesse and Sculptra. Is there a good platform to having a little bit of a combination of both?
Absolutely. There is. And I think like everything, the pendulum swings. And the pendulum is swinging now toward regenerative medicine. And you mentioned, too, that we use very frequently, which is Sculptra polylactic acid, and Radiesse, which is a calcium hydroxyapatite. Back in the day when Radiesse first came out, we used it as a filler. I used tons of it in the mid-face before Jupiter and Voluma was FDA approved. And now we hyperdilute it, which means we mix it with a saline solution. And when we inject it, just like when we inject Sculptra, we're injecting it in a fanning method, kind of laying down tiny little strands or planting seeds of these biostimulators that then the body responds by creating more collagen. And I tell my patients, I'm planting the seeds, but how your body responds to that can be very different. In order to make collagen, you have to have the resources to do that. You need vitamin C, you need good nutrients in your body, you need protein in your diet, don't smoke.
Smoke.
Everybody's going to respond differently to it. And generally, it is done in a series of treatments.
Yeah, and I love a combination of both. I'm like you, where I talk about that as being the foundation, right? How are we going to get back into that natural look? And then the fillers are little wow pops, right? Like we're not going to really get that cute little cheek unless we're doing HA filler on top of that. But having a combination, I think number one, helps us kind of age backwards and just look more natural and more youthful. So I really love that kind of concept.
I like to use the biostimulators more in the lateral face, in the temples, combined with dermal filler in the temples, but also in the neck, the chest and décolleté, the backs of the hands.
Yeah, so you're talking about that, we really believe in combination treatments. We know one procedure is not going to do it all. It's not going to be just Botox or just a filler, whether it's ultherapy, lasers. What is your favorite combinations, and do you believe in that works better for our clients?
Our model here is we offer patients a complimentary skin imaging and assessment, and that's done by our estheticians. I compare the face to a pillow and a pillowcase. So when we're doing dermal filler, when we're doing Botox, we're addressing what's going on underneath the skin. We're relaxing muscles with the neuromodulators, such as Botox. We're restoring lost volume with our dermal filler. But if that pillowcase is dirty, it's a mismatch. And I tell people, if you remodel your house on the inside and not paint the outside, your house is still going to look ratty on the outside. So we need to take care of the skin as well.
Yeah, absolutely. I love that. So we are a very heavy aesthetic practice, but we also love the concept of functional medicine and really practice that in a combination in our practices. So tell me a little bit about, how that incorporates in your practice. We know that obesity is a large issue in this country. The GLP-1s have done amazing. Talk to me a little bit about GLP-1s and how does weight loss go into your practice?
It's a huge part of our practice. My background before I opened Radiance, and if I can just say the name, Radiance Medical Aesthetics and Wellness, powered by Formula Wellness. We opened 20 years ago. My background is internal medicine, endocrinology, and family practice. And the reason that I transitioned was I became very disillusioned with traditional medicine. I felt like I was writing prescriptions to treat symptoms, not getting to the root cause of what was causing those symptoms. And so it just seemed natural, if I was going into aesthetics, that in order to have healthy skin, we have to be healthy from the inside out. However, obesity is a huge epidemic, not only in this country, but across the world. And there are, I think it's 236 preventable diseases associated with obesity. And the statistic, I wrote this down, 2.8 million deaths worldwide due to obesity-related diseases. So it's a passion of mine. Yes, we can make somebody's wrinkles go away, but if they're not healthy, if they're overweight or obese, and, obesity and being overweight is a chronic relapsing disease. We can help people get the weight off, but it's an ongoing issue. And I've experienced that as I've gotten older. It's just harder to keep the weight off. 30 to 35% of the U.S. population is obese, and 70% falls within that category of being overweight or obese. So we've got a huge population out there who can use our services. And yes, the GLP-1s are great. Like anything, there's pros and cons. There can be side effects, but I think we're seeing with the GLP-1s, there's a ton more positive benefits of the GLP-1s. And there are a handful of side effects.
The Formula Wellness 4 cornerstones are nutrition, functional wellness, aesthetics, and brain health. These serve as a guide rail for individuals that are pursuing longevity inside and out. Formula Wellness is setting the new benchmark in preventative healthcare and aesthetics. Thank you for all of your support. To learn more, please visit www.formulawellness.com. I always tell patients it's much easier for me to make you look aesthetically pleasing, right? Removing your wrinkles, giving you some volume in your face. It's much harder for me to make you feel well on the inside, because that really is something that you really have to do with me. Like you said, we need to look at your diet plan. We need to look at your hormones. We need to look at your weight. We need to look at your heart. We're looking at a full comprehensive panel. I think that's why I have really, really, truly loved doing our 360 diagnostics to evaluate that. And you're right, even when they come in, let's say they come in with puffiness under their eyes and they want us to fix it. Well, I start looking at their gut, right? Well, let me look at your thyroid, your hypertension. What are you doing with sodium overload? And they really think it's just aesthetic. And everything we do on the inside shows on the outside. And so I think that education with our patients is so important.
Absolutely.
I love that. So when we talk about functional medicine, right, we are very systematic here. We do our diagnostic, a full lab panel to really go over that. And then we stepwise fashion, just like if we have an aesthetic plan, right? We have a plan of what we're going to do today, 3 months, 6 months, 1 year. Well, I think that's the same component in functional medicine. You practice internal medicine is, what are we fixing right now? Are we working on your sex hormones first? And then are we working on your thyroid? Are we working on your weight? But all of it really systematically plays out. Do you agree with that? Is there a better system?
No, I think, as I mentioned in family practice, it was basically treating the issue at the time. And yes, there are chronic diseases, hypertension, diabetes, that we would see patients on a recurring basis. But I think if patients understand that this is a process, and this is our goal for 6 weeks from now, this is our goal for 3 months from now, and they're buying into the plan, and they understand that this is going to be a process.
Yeah, being patient with that process, for sure.
40 years of unhealthy living, it's going to take some time to reverse that.
I agree. I think people think that it's going to be overnight, and it's actually really unhealthy to be overnight, right? People want to lose 30 pounds in a month, but they don't realize that they're losing muscle, right? They're not taking enough protein. It really affects every other body. It can affect their kidneys. I tell people, if it took you 10 years to get here, at least give me a year to start to reverse that back, not 30 days, and think that that's a healthy way of reversing what we've just done to our body.
I'm glad you mentioned protein, because I think it's really difficult to get our protein intake. What is your recommendation on milligrams per kilogram of body weight for patients?
Yeah, I would say somewhere between 1 to 1.2 per kilogram per weight if you're not active, and a lot higher, at least 1.5 if you are active. But we know, and I was just complaining about myself, is I get in a good routine. I try to have my 100 grams of protein a day. You start to do really well, and then we kind of forget. And as women, especially postmenopausal women, not us, but postmenopausal women, is that we actually need more protein, and we go into this fasting all day long, working and not getting enough calories and not enough. And you'll notice we don't lose weight doing that anymore. That was something what we did when we were younger, but we really need that protein to maintain our muscle, to help us not get osteoporosis. It really kind of plays in that role. But I think as women, we're so used to just fasting all day.
Yeah. And, I think you have the Sika scale. We do too. It's a bioimpedance scale, and we can measure protein. So when measure muscle, so that when patients are on our weight loss program, we can track that and make sure they're not losing muscle. And I tell patients, when you talk about diet, that's a very negative word. People shut down when you talk about diet. And so I just encourage, get in your 100 grams of protein a day, or maybe 120 grams of protein a day. And if you're focusing on that, you're going to be full, and there's not going to be room for those extra carbs. And then, as we all know, when we cut carbs out of our diet, we don't crave it.
Right. I think in this country, though, is getting away from anything that comes in a box. I always tell people, if it's Cheetos in a bag or cereal in a box, it's taking away those starches that are really not healthy for us, and going back to more farm to table, right? Healthy food that's going to be on our plate. You can eat as much as that you want versus eating a couple of cookies from a box. Way different on what it does to your system.
Right. Shop the periphery of the grocery store.
Which is really difficult, right? I think everybody kind of goes into the middle. I would definitely say for younger women, I think the hard part, and where we're seeing a lot of people becoming a little bit larger and more overweight is that we all try to finish our children's plates, right? So they're having chicken nuggets and French fries at McDonald's all the time, and they're just eating and they're finishing their plate. And moms will tell me that. And then as we get older, we get a little smarter not to do that. But then we get into not having hormones and the fluctuations of the changes. So I think we're always struggling. I think women are always behind the eight ball trying to get to where they want. But I think, like you're saying, is if we go back to just more clean living, right? Yeah. Decreasing our stress, eating a little bit better, all of that kind of falls into place.
Yeah. And mentioning our children, age 12 to 19 in the U.S., 22.2% are obese. And that is so sad. That is so sad. It's modeling behavior for our children. When my children were younger, we had a garden in our backyard, and they were involved in planting. If they planted it, they wanted to eat it. So not to say that they didn't eat those chicken nuggets or pizza, but
yeah, we all do.
Yeah.
I think one of the things our listeners also may not know, that fat cells are only made when we're children. So as we're children and we're eating improperly, we're gaining new fat cells, which then increases our risk of obesity as we get older. And I think people don't realize that as adults, we do not make any new fat cells, but what we do is we expand them. And so weight loss is about taking these fat cells, losing weight, and then we gain weight, they expand and they shrink. But when you're a child, you're actually making new fat cells, which then is going to make it so much harder to lean down as an adult.
Exactly. And fat cells are metabolically active. They're not just blobs of fat. They are producing hormones. They're producing cytokines, inflammatory markers.
Yeah, right. And I don't think people realize that fat cells actually have a lot of estrogen, right? And so when you have more fat cells, you're going to be a lot more estrogen dominant, which then may cause other problems later on. And so it really does have a full 360 ability when we look at everything that we put in our mouth, from our weight to our hormones. It really needs to be synchronized together. So this is funny that you were talking about the Sika scale. So I took the Sika about a month ago, and I was laughing because I felt like I had chicken arms. Like I had just no muscle in my arms. And I thought, oh my God, this is just so terrible. So I started my little workout routine again, resistant weights. And I'm so happy. I gained 2.5 pounds of muscle over the last 30 days.
Good for you.
So excited. It was not easy, but I think that if we just, every little win as women, we have to take it, right? And so, because as my weight went up, we start going, oh my God, I'm doing something wrong.
Right.
Let me change that. But the Sika scale really gave me the ability to say, okay, well, the majority of that was muscle, and that's what I wanted, and that's what's safe. And so I think we sometimes need to get off the scale and really look at the full picture, but very difficult, I think, for us.
All right. So I'm going to turn the microphone around. Dr. Suarez, tell us how you gained 2.5 pounds in muscle. And did you say a month?
In a month. I think it helps that I probably didn't have much muscle in my arms at all. Most of my muscle is in my torso and legs. And I think as women, we always do our squats, our lunges. We want to have great legs. We want to have a great bouncy booty, right? We try all of that, but I never really think about my arms. I'm like, oh, they're fine. But if we don't work them, we are going to get those fatty bat wings as we get older. And so for me, I was like, you know what do I need to really gain? And so I actually, for the first time in my life, hired a personal trainer that would push me to go in. And then I do cardio on my days that I'm not, with him. And so it's really gave me the ability of putting that on my calendar. I also am a creature of habit, and we get very busy in life. So my workouts are now programmed in my calendar as an appointment. Just like if I had an appointment with a patient or a doctor, it is an appointment that I cannot miss. Every single day you have to put that in. And I think for me, that's how my mind has to function, that it has to incorporate into my everyday life. Or if not, I go right back to, I'm fine, I'll be okay, but we're really not.
Yeah. Do you take any supplements to help build protein, like creatine or BCCAs?
Yeah, well, I probably take way too many vitamins. I tell my patients all the time about, having too many pills, because then we'll become non-compliant. So I do switch mine around. I do drink protein every day because I can't get enough of I can't get enough meat in my diet. It's not my favorite thing. And so I have to take supplements for protein. And of course, like you, I take a lot of vitamin C. It was really interesting that I did a micronutrient panel a couple of months ago, and my vitamin C and my B5 were pretty much zero. And I thought, that's impossible. However, think about how much we detox every single day in our body. My body happens to need double the amount of vitamin C just to be able to process and detox my body. And so doing these kind of testing really opened up my eyes that sometimes just taking a couple of vitamins here and there is really not enough. And we need to take back and monitor our system and make sure we're as healthy as we can be.
Right. Sometimes we're just guessing when we're taking supplements. So I think that micronutrient testing is great.
Yeah, and you look beautiful and you are in great shape. So how do you maintain looking good from the inside out?
Well, I do try to take in 100 grams of protein a day. I start out my morning with Ensure Max because it has 30 grams of protein. It's hard to get that much protein in the morning. So that starts the day. So I focus on a healthy diet. I work out 5 to 6 days a week. So I'll spend 20 minutes doing cardio, and then I'll work out one area with weight resistance. So one day maybe arms, one day maybe core, and one day maybe legs. But I'll do that 5 to 6 days a week. I don't do cold plunges. I hate the cold. I hear, grounding is good. I don't take time for things like that. Um, as far as, meditation and calming, and I start out my morning with a Bible reading and Bible study, and then I go to the gym. Um, I don't know. I'm just have a wonderful family and very happy, and I think happiness also is good for our health.
Yeah, look, it is a multidisciplinary approach, right? Everything counts. And when people tell me, how do I lower my stress levels, right? And I think as providers, we'll go, okay, we'll take some ashwagandha, do this, do that. But you're right, you take a step back. I always tell people that's the hardest thing for me to do because number one, I can give you supplements that will help, but you need to relax. You need to turn off the TV. You need to turn off the blue lights. You need to read a book. You need to pray. You need to do whatever that makes you go into your happy zone and relax. And I think we live in a world that's so busy and so like jump from this to that. We don't really take that moment to breathe, to enjoy our families, to enjoy our life. And I think that's the hardest prescription. When I tell patients to do that, they kind of look at me like, you don't have just a happy pill? I'm like, no, I don't.
Yeah, I am not a coffee drinker in the morning. It just doesn't taste good to me, but I like my English breakfast tea. So, yeah, I'll sit there with my Bible and my English breakfast tea and spend some time.
I absolutely love that. Look, if there's anything we can do is have people do self-care, take care of themselves out of work, not just at work, take care of themselves with their family. I think we need to get to a point where we feel great, and it doesn't mean that we can't do it all, right? We work very hard, and then we need to take that time for ourselves, and that's really, really difficult. I think as entrepreneurs, we're always working, always focused, and I think as we get older is when we realize, well, I don't want all that time to go away, and I want to love on my kids and love on myself and love on God and make sure that we're just going down a great path.
Yeah. And you know what also feeds me? Yes, I need that quiet time, but I also need people. I guess I'm half extrovert, half introvert. I just got back from Women in Aesthetic Leadership Conference out in California, and it was fuel to my soul. It was being around other professional women in this industry who, I tell you what, I don't know of any other specialty of medicine who have people with such great hearts. I think we're in it to help other people, to uplift other people, help them with their self-confidence. My patients say, well, I've had my Botox in my therapy session today. Oh, um, but it was a great weekend, and I feel recharged coming back from that.
Yeah. Look, women supporting women and encouraging, it is a big pet peeve for me to think that women can't uplift other women. We are all in it together, and there's nothing more special than to have an amazing group of women that you can lift around you. So thank you so much for continuing to be part of that system and making sure that we're all doing okay and that we continue to improve.
Well, you too.
Thank you. So this is our last question, and that is, what does beauty mean to you?
Well, science tells us there is a golden ratio, and that has to do with facial proportion. But I think we all have known people that are on the outside absolutely physically gorgeous with that golden ratio. But as the book of Matthew describes it, the Pharisees were like whitewashed sepulchres with just bones on the inside. And so that's not a beautiful thing. And we also have known people who are the most beautiful people on the inside, that if you, first impression on the outside, you might not think that they're the most beautiful people. But I think it's a package. I think we in the medical aesthetics industry help people look their best on the outside. We enhance their beauty, but it also is their energy, their essence, and their kindness and confidence, and all of that is a package.
Yeah, I love that. Energy, essence, it's a combination of what they are inside and out, and I truly believe that too. When you are so beautiful inside, you really project that outside, and it just glows and beams around you. I love that. Thank you so much for coming and speaking with us. I hope Texas has some beautiful weather like we do here in Florida. I hope to see you soon. And
Yes.
thank you for so much for coming on.
Yes, dear sister, thank you. Thanks for the invite.
Yeah, absolutely. Be blessed.
Bye-bye. You too.
Bye.